Hello, my name is Daniel Corbin. I'm a BSN 246 and today I'll be doing the NG tube insertion skill video. To begin my video, I'll check the doctor's orders. The doctor has ordered an NG tube for one of my patients, so I'll begin by gathering supplies for my procedure. I have my pair of gloves, chuck, cup of water, 60 ml syringe, tape, safety pin, lubricant, water basin, my NG tube, my pen light. Also have a specimen cup and a pH test strip. Begin by entering the patient's room, closing the door behind me for patient privacy, performing hand hygiene, introducing myself to the patient. Hello sir, my name is Daniel. I'll be your nurse today. Can I get your first, last name, and your date of birth, please? I'll check the patient's wristband for 2 patient identifiers. Well, Mr. Smith, today the doctor has ordered an NG tube. What that's going to do is keep your stomach contents clear so we can focus on your bowel obstruction and let your bowels heal. Do you have any questions before I get started? No? Great. I'll begin by donning on a pair of clean gloves. Okay. Begin by putting my NG tube in a basin of warm water. Okay, so I'm going to be inspecting your nostrils. If I have you look up for me. Using my pen light, I will inspect the nostrils. I'm looking for any irritation, abrasion. I'm also looking for any abnormalities. Including obstructions or deformities that can prevent me from inserting my tube. Everything looks great. I'm going to have you occlude one nostril and breathe in and breathe out. Now occlude the other nostril, breathe in and breathe out. Great. Ms. Smith, your right nostril seems to have a little greater airflow. Is it okay if I use that nostril to insert my tube? Okay. Put this down here. Patient with my chucks. Okay, I'm ready to measure. And I'm measuring from the nostril to the back of the ear, and from the ear down to the xiphoid process. You're looking at about 50. Perfect. Now I'm ready to lube up my tube here. Alright, sir, I'm ready to insert into your nostril here. Now I'm going to insert. If there is any blockage or resistance, I will exit, or I will take out my tube, re-lubricate, try the other nostril. This one seems to be going fine. I'm going to be inserting until the oropharynx, where the patient will likely gag. At that point, I'll take my cup of water here, and I'm going to, with a straw, I'm going to have you tilt your head forward. Okay, and you're going to be taking a sip of water, and every time that you take a sip and swallow, I'm going to be inserting the tube about 2 to 4 inches. You ready? Okay, ready? 1, 3, and swallow. Good. One more time. Doing good. Keep coming, keep swallowing. There you go. Good job. 1, 2, 3. And 1, 2, 3. All right, one more from 1, 2, 3. Swallow. Good job. Now we're at 50 there. Once the tube is inserted, I'm going to check the hospital's policies on tube placement. At this point, I will take that off. I'm going to be taking out about 5 to 10 mils of the gastric content, putting that into a test tube or my specimen cup with my pH. I'm generally looking for about 1 to 5. That will indicate that I am in the stomach. Okay, once that is on there, I will attach using a piece of tape. Attach it on the bridge of their nose. wrapping it around, securing my device. Okay. Once it's on there, I will order a chest x-ray to confirm I do have it in the right spot. Okay. At this point, I will attach the tube to my patient's gown using my safety pin. All right, once the x-ray is confirmed I do have it in the correct spot. Again, if there was any indication that I was not in the right spot, I would take out the tube, relubricate, try to start again. However, everything looks to be in a good spot there, so I can start cleaning up my supplies here. Well, before I start cleaning up supplies, once I do have the placement confirmed by x-ray, I will then attach this to my suction. And when it's on suction, I will make sure it is patent, there's no clogs, there's no kinks or clamps on it. Okay, now I can start fully cleaning up here. Okay, and at this point I will make sure I am documenting, taking a look and assessing the contents of it, looking at the characteristics and the amount of the content that comes out. I will put the bed in a low position. Make sure my patient is comfortable, make sure the call light is close by. I will assess, I will document the assessment, the characteristics of the tube, I'll also document the patient's response and the procedure.